perform a little fascia release on your thigh, on each side, because sometimes it's just important to free up the muscles and the tissues and the fascia around the hip joints.
Okay.
Can I show you how it's done?
Of course.
If you lie down on your left lateral side now. We will do both sides, of course, but we start with one side. I give you a little cushion to hold. Thank you. And we will do this together, just for ease. So we bring the thigh and the knee into a neutral position. Notice that I've got the ankle flexed upwards. And then what we are doing is actually listening to the way in which your tissues wish to move. After a while, your own fascia begins to want to move in its own craniosacral rhythm, and we just follow it the way it wants to move. It is important to understand that we are not manipulating your tissues, that the tissues are moving in the way that they want to move, where they want to move. They're having a little bit of flexion. We're just following it through. And it sometimes moves in weird and wonderful ways, sometimes even off the bed, such as like this. And then notice that I'm just using a fingertip sometimes to just support the leg as it wants to go in its own direction. And now it seems to be wanting to go away from me. And then it drops down, and we allow it to just drop, 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 unwinding all the tissues and the fascia around the right hip joint. Then it wants to come up here, and then we flex the knee. The knee wants to flex, we are just following it easily. And then with your eyes closed, you allow these wonderful movements to feel almost hypnotic for you. You will notice that as we go on, the hip joint takes on an even more dramatic range of movements, sometimes going all the way up, higher and higher. And we are just following it. We are the servants of the craniosacral fascia release. That's it. It's wanting to invert a little bit. And it wants to come all the way up. And it wants to fall out. That's brilliant. There's a point of restriction there that we are happy to encourage and hold for a little while till its own release happens. And then the thigh and the leg wants to really extend. Then it wants to come back. Just following it naturally, beautifully, all the way up. Supporting it, seeing where it wants to go. It's very important to remember that we are not moving this limb. The limb is moving by itself. Imagine all the muscle fibers separating bit by bit, bit by bit. And the fascia is releasing millimeter by millimeter, creating more space and freedom of movement in the pelvic floor and in the hip joint area and in the adductor zones. Really releasing gorgeously. We kind of bring it to a close there. And then we will ask the lady to move on to the other side. And we unwind the other thigh. Bring the leg again into neutral. This movement is also very hypnotic and allows the mother to go into a lovely deep trance. It's comforting. Feeling the releases all the way through. The knee still wants to remain bent. Now it wants to straighten. And it wants to go in that way. Gently in its own rhythm and own space and own time. Letting it drop, drop, drop. And then bringing it back to neutral, so that it can start a new cycle of unwind. I notice that both limbs have got completely different patterns of unwinding, which is interesting. They both have different ways of releasing. The hip joints and the knee joints. Get a beautiful, nice stretch, and then bring it back to neutral for another cycle of unwinding. It's getting softer and easier now, which means some of the fascia has become soft and loose and relaxed. Perfect. Perfect. Bring it back to neutral, and we'll bring this to a close.